November is Chronic Obstructive Pulmonary Disease, better known as COPD Awareness Month. It's a serious lung disease that makes it hard to breathe. And here to talk more about this is Dr. Jay Mazes with Tampa General Hospital. Dr. Mazes, thanks so much for being here with us.
Thank you for having me.
So let's first talk about what exactly COPD is.
Okay, well, as you mentioned, COPD stands for Chronic Obstructive Pulmonary Disease. And it's a lung disease that is characterized by chronic respiratory symptoms, shortness of breath, cough, it can have sputum and or flare-ups, exacerbations, and it's due to abnormalities of the airways and or abnormalities of the alveoli, which are the air sacs that transfer oxygen into the blood.
And I mean, this can be deadly.
Yes.
Yeah,
yes.
Definitely. So who does this affect?
Well, in the United States and higher income countries, mostly it's a lot of smokers, obviously. But there's also other major risk factors, more so in lower and middle income countries, air pollution, and indoor and outdoor air pollution, and also occupational and workplace exposures. And there's also genetic risk factors. There's a disease called alpha-1 antitrypsin deficiency, which, albeit rare, can cause emphysema in never smokers. And we screen for this in every COPD patient we diagnose.
Yeah, and you were mentioning that 1 in 4 people who are not smokers are at risk for COPD.
That's correct. So they would fall into these categories, and also there's other risk factors. There's genetic risk factors. We kind of look at it as genetic and environmental over the lifetime of the patient. So things that impair lung development and growth, low birth weight, premature birth, bad lung infections as a child can cause increased risk. Asthma in children can also associate with a potential increased risk, and asthma in adults, often severe and persistent, can progress onto COPD.
Can you talk a little bit about the advancements that they have when it comes to treatment?
Sure. Well, the mainstay of chronic management is going to be inhaled medications, also lifestyle modifications, risk reduction, avoid smoking is of the utmost importance. No matter what the stage of the disease is, it's never too late to stop smoking. There's drugs, medications, which we use inhalers. The mainstay being airway medications that dilate, open up the airways to make it easier to move air through. There's also a subgroup of patients who benefit from inhaled steroids. We've done some research and we're finding out which patients do better with this. We have combinations of these therapies, long-acting versions, which we've combined in double inhalers and triple inhalers, and actually triple inhaler therapy in a subgroup of patients, a specific subgroup of at-risk patients with moderate to severe, has shown a survival benefit.
Dr. Mazes, you mentioned, again, smoking. What if you're someone who doesn't smoke but maybe lives with someone who does?
So that poses an increased risk too. That's secondhand smoke or environmental smoke. These are also risk factors.
So anyone watching, who may say, hey, I have some of these symptoms, what should they be looking out for and what should they do?
Right. So if someone is complaining of, say, shortness of breath on exertion, maybe it's persistent and progressive, or their activity is limited, they can't do what they used to be able to do. They have a chronic cough, maybe they produce sputum. They wheeze, maybe they have chest tightness, or they're fatigued early. These are signs, these are concerning signs. These are not normal things to have. So these are the kind of things you need to go see a doctor for. And, or if you're having frequent respiratory infections, this is something you need to pay attention to.
And can this affect anyone of any age?
It can, yes. Albeit a disease of middle age and older, it actually develops younger, and it takes time to show itself.
All right. Dr. Mazes, thank you so much for being here with us today. If you would like more information or to watch this interview again, you can head to our website, WPBF.com.